The next group I want to share with you is we're going to talk about we have a roundtable discussion on the need and opportunities to amend Title X of the Housing and Community Development Act of 1992. And it's a great group of people. I'm only going to tell you about one of them, and then she will introduce the others. So this woman is the executive director for the Children's Environmental Health Network, serves on the External Science Board for the Environmental Influences of Child Health Outcome in NIH research work, and is the board chair for the Pesticide Action Network of North America, a board member for the Environmental Integrity Project, and serves on the Maryland Children's Environmental Health Advisory Council. Please help me welcome Nsayadu Obat Witherspoon.
Good afternoon. Really sorry that you're not getting a chance to stand up. The public health person in me wishes you could. So please, I would say if stand up, stretch, as we're calling folks, I understand how important that is, and it really helps focus. So again, I'm Nsay Witherspoon with the Children's Environmental Health Network. If you haven't heard about us, we're a national nonprofit. We're celebrating 30 years this year. We actually have always had the same mission to ensure that children have the safest, healthy environments possible, and clearly their home environment is a very critical part of that, and their moms, women of childbearing age, and anyone else in their families. A big thank you to Sarah Goldwyn, Policy Analyst for the National Center for Healthy Housing, for organizing this session, which I really do believe will be informative to you in your work. So our panelists include Dr. David Jacobs. He's the Chief Scientist at the National Center for Healthy Housing, a national nonprofit working to ensure that everyone has equitable access to safe and healthy housing. Dr. Jacobs serves as the director of the U.S. Collaborating Center for Research and Training and Housing-Related Disease and Injury for the Pan American Health Organization and the World Health Organization, PAHO and WHO. He's an adjunct associate professor at the University of Illinois at Chicago School of Public Health and as a faculty associate at the Johns Hopkins Bloomberg School of Public Health. Ruth Norton is the president and CEO of the Green and Healthy Homes Initiative, a nonprofit organization that is dedicated to advancing racial and health equity and opportunity through healthy housing. She directs GHHI's groundbreaking work across the United States, where 65 cities, counties, and states are using housing as a platform for improved health and social outcomes. Tom Neltner is the Senior Director of Safer Chemicals for the Environmental Defense Fund, which focuses on removing or minimizing hazardous chemicals from products and the marketplace through cross-cutting policy initiatives. And Larry Brooks is the director of the Alameda County Healthy Homes Department, which includes the Lead Poisoning Prevention Program. He is also a board member for the California Association of Code Enforcement Officials and a board member for the Lead and Environmental Hazards Association. Please welcome all of our panelists. We're going to have a good discussion this afternoon. So again, welcome all of you. I have some questions, and then we're going to open it up to your questions. So the first question that I have here is, what do you see as the biggest success of Title X over the past 3 decades? And how can we build on that success?
I think it was probably finally understanding how exposures really occur. And secondly, for the first time, making clear assignments to the various federal agencies on who was supposed to do what.
Any other thoughts?
Yeah, I'm going to go by what matters most to me, and that is lead levels in children went way down. That's connected to Title X. They're not disconnected. The lead-based paint statute drove those levels down, and we need to recognize that. Also, I'm not the statistician here, but the disparities dramatically narrowed. And that's a real success, and I think it's due to what HUD's done, what CDC's done, what EPA's done. I will say one other aspect, and that is the enforcement. In the early years, it was enforcement on the disclosure. For all the landlords who just couldn't figure out how to do the disclosure, HUD required and EPA required that they cleaned up a lot of property, which built the capacity and the momentum. And then more recently, EPA taking action against those crazy home fixer-upper shows that just violate all the renovation, repair, and painting rule, and credit to EPA for taking action against them and for Home Depot, which changes the whole dynamic. So I think some of the Title X has dramatically accomplished its goal. We've still got more to do, though.
I would say we have a lot more to do, and I'm more interested in the next set of questions. But I think it created a statutory approach and a permanent set of funding that addressed an issue for one of the first times that was devastating the Black community in this country, and actually started a path towards what we need to continue to do in better equity. So it also created a bipartisan approach. It's one of the few issues that has survived over 30 years to continue to have bipartisan support in Congress. I'm super proud. Where's all my Baltimore people? Hello, Baltimore. But we're the home of Barbara Mikulski. And Barbara Mikulski, a senator from Maryland, established the Lead Hazard Control Program along with Kit Bond as the lead sponsors. So we're very proud of that fact. But I think it set a pathway for learning. It set us on a path to take care of an issue, probably too narrowly, but we'll talk about that in just a minute.
Thank you. Spoiler alert here. I'm a recovering code enforcement officer. That's right. I sit on the board of directors for the California Association of Code Enforcement, so I guess I'm still an addict here. What it did for me was it introduced me to the dangers of lead. When I started in my career, code enforcement officers were being told, lead paint, peeling paint, what are you talking about? That's curb appeal, you don't do that. And through Title X, I began to learn, no, we should do that. So that's what it did.
Thank you all very much. So what new needs or lessons learned have emerged that we didn't know about back in 1992, in your opinion?
I'll start. I think we need better guideposts on how we approach equity. Not just that we think we're going after low-income communities or distressed housing, and it means that we're being equitable in how we apply this law. And we need monies in this that allow for capacity building, because some of the best policies, best work I've ever done is informed by the people who are living this, who are working there, and I think we need flexibility in that. We need better alignment to ensure lead in all policies. And lead standards that we have in the Office of Healthy Homes need to go throughout HUD. There are HUD programs who do not meet the same standards in housing quality inspections in public housing, for example. We need broader definition of health and housing, more flexibility in the funds to better align with the programs that are here today and are coming in the future, most especially around issues of climate, decarbonization, and other things that also are about health. We definitely need the allowance for full abatement. Interim controls is half an answer for people who are living with hazards. It's the same answer we've given in historically disinvested communities forever. Why do a lower standard than what we know, which says there should be no lead in the house, and allow us to take it out? You can disagree with that, but I'm telling you, I wouldn't want my child exposed on that. And flex on cost to scale contractors. We've got to build a workforce. We need to be able to give flexibility how these programs are run so that we can offer contractors more jobs in greater quantity, that we can adapt to the wages that need to be paid in this work. And we must track the equity dollars we spend, who we hire, how we help contractors become owners in their community, how do we employ people who are impacted into programs. We need to track that much better.
Thank you, Ruth Ann. Others?
I think probably the main deficiency is that we do not have a Title X for healthy housing. Congress has never authorized it. And so it's unclear who's supposed to be handling which particular hazard. We have attempted to apply the lessons we learned from lead in the 90s to the Healthy Housing Initiative, but we need a clear directive like we had in Title X. I do want to clear up one thing, however. I helped write Title X, and the fact is it never prohibited abatement. It provided for both, and we need to do both things at the same time. We have two legs. We need to walk on them both. We do the short-term and the long-term thing, just like we do for any other housing hazard. We have capital improvements. We have maintenance. We do them both, and that protects the most kids as quickly as possible. But I'll talk more about that later.
Okay, spoiler alert here again. As I sit here with this panel of my rock stars, the people who have motivated and have mentored me, I think in terms of, again, what do I bring to this panel? And it's that code enforcement perspective. And that's what I think is needed now in terms of what we've learned. The code enforcement has learned that, you know, you do ugly. We were told you don't do ugly. It's curb appeal. Now we need to take what we've learned through Title X and apply it in strategies that will help to improve code enforcement's response to lead hazards.
I'll go ahead and add 3 items on top of Ruth Ann's. I agree with all that Ruth Ann said. It's always nice to be able to do. Big picture, disclosure didn't work. Disclosure was a great idea, but there wasn't the market incentives to get the next necessary testing or the people out there to do it. I think it still has potential. I think that's one that we could figure out how to better leverage the disclosure, short of the enforcement when they just failed to do the paperwork. Second, the RRP rule enforcement and the state compliance was grounded on fees paid by those who got the license to do the work. And that left states with a difficult position, so we didn't get enough delegation. So RRP enforcement, which is not so much EPA's fault, but it's really just the dynamic in the law and that requirement that they pay for those ones. The other one I have to say is the statute was written around the idea that there was a safe level. I know we talked about it, but it was built around 10 micrograms per deciliter as the safe level, maybe lower, but it wasn't built around it. And that's why I think Ruth Ann's point about abatement is so important. Because now that we know there's no safe level, we need to look at all sources, and we need to look at those existing sources, including paint, differently.
Thank you. So what do you see as the most critical potential amendments? You're already getting into some, potentially. But when we think about specific amendments now 30 years into this law.
Oh, yeah. You know what's coming. I think that there needs to be some amendments that will create some code enforcement incentive grants so that local jurisdictions' code enforcement programs will go out and do enforcement. We took a EPA grant, thank you. We took an EPA grant, and as a pilot proof of concept, we trained some code enforcement officers throughout California in RRP just to see if they would go out and enforce complaints about contractors and laborers not doing work properly. And it worked. And as a result of that, this past year, the Code Enforcement Association of California co-sponsored a bill to move EPA enforcement from the feds to the state, and the governor signed it.
I'm gonna back on the disclosure part. I work a lot on lead pipes. You probably have heard that, lead service lines. We've got to get that back into balance. We need to do both, pipes and paint, okay? But in the next 2 years, 1,000 water utilities representing 60 million homes are going to be posting online who's got lead base or lead pipes, or who doesn't, or what's unknown. Think about that. For virtually every home in the United States outside of rural areas, we're going to be able to tell whether they've got a lead-based pipe or a lead pipe. But we will know nothing about whether they have lead-based paint. We will know nothing about whether it's already poisoned a child. And that just doesn't work. We need to complement that. That's going to set a backbone that I think we can build on. But we have to find a way to get the lead-based paint information out there in parallel with the lead pipes, so we have context, but we also get action on both. I think that's the solution.
We need to use the power of the pulpit of the money we're giving out. So I think about Wisconsin that still has 20 micrograms per deciliter as an action level. We need to find a way that if they want lead-based paint money, they got to move that down, right? We've got to build incentives and teeth in that to walk the walk on something that we adopted at the Lead Advisory Council at CDC in 2012. There is no safe level. That's got to be bedrock continuing in what we do. Absolutely agree with you, Dave, that we've got to have full flexibility and statutory permanency about healthy housing. Because healthy housing, if you're in Jackson, Mississippi versus Baltimore, Maryland versus Milwaukee, Wisconsin, has different issues. So we have to be able to do that. We need a wider use of money for places like childcare. Childcare has to be funded. The biggest requests we get are childcare needing assistance and the hardest money to get, and that's where kids also go. We got to track that too, right? But data, data, data. We need a national database. Every HUD grant we get should require that it's reporting into a unified database around what we know on housing violations, on what we know on what we do, and where we spend the money. I can continue on a number of things, but flexibility is also the other thing that matters. Yes, on DOE, we worked hard for a decade to get that alignment, but there's so many more dollars coming now, and we have to think about health of housing and those impacts together. So from the pipes, the soil, to the climate, lead in all policies.
Okay, since I'm getting on in years now, I need slides. And I guess I broke the rules because I guess we're not supposed to have, but could we have the slides on? Otherwise, I'll forget some stuff. So, and you can take pictures of these, by the way. I don't, you know. But basically, I think where we've been in the past is we had this medical approach from 71 to 90. There was no understanding of the importance of lead dust. We had the wrong definition of hazard, which was just the presence of lead paint. From 91 to about 2014, I'd say, we had this small housing-based primary prevention approach, and then I can't see this. Oh, and then finally, we've, I think, achieved some economies of scale where we finally expanded it to some real significant numbers. Matt talked about that earlier with the appropriations. I'm going to skip through some of these. These were the bad old days, right? These were work practices that focused on the presence of lead paint. So the idea was get it out of your house as quick as possible by any means necessary, and that, of course, poisoned workers like this guy, as well as the kids who moved into those houses. This is one of my first studies, actually, in the public housing. It's a great way to take off lead paint, but it doesn't work, and it contaminates the houses. Open flame burning is now banned, thankfully, but it took research to show how dangerous these practices were and to put a stop to it. This is the pathway. I'm going to skip this in the interest of time, but it took a long time for the science to come to realization that it was the dust and the hand-to-mouth contact that kids were exposed to that affected their blood lead. That wasn't obvious in the 80s at all, and that led to a problem. So my best estimate now is we have about 590,000 kids who are above the current reference value. Based on a new calculation I did, about 4.3 million of those kids live in homes with lead in 2019, according to HUD's Healthy Housing Survey, and the racial and ethnic disparities remain pronounced. I'll be publishing this next week in the Journal of Public Health Management and Protection, so you can see some of the data, as well as, well, that's what it looks like. You can see, I'm not going to focus on this for now, but we can talk about this later if you'd like. Deteriorated paint rose by 4 million housing units since 1999, between the 1990 housing survey and the one in 2019. So the housing stock is getting older, and that means the paint's deteriorating, which causes perhaps some increased exposure. So we've made a lot of progress, as those graphs show, but we still have a long ways to go. So as I mentioned, Congress has not reformed this law in more than 30 years, as well as the OSHA Act and other laws. So we need to protect children, scale and optimize markets, subsidies, enforcement, and end this ineffective cost shifting that goes on as a result. So the key reforms, in my opinion, we have not had a cabinet-level federal interagency task force with a forecast and an interagency budget to really bring it to fruition. We had that in 2000. The very first sentences or two of the current federal strategy says this is not a budget document. So without the money, we know nothing's going to happen. As Tom said, disclosure is limited to known lead paint. There's a reason for that. The original version of Title X would have required a lead inspection. The real estate industry fought that, and they won. So we didn't get that through. With regard to codes, the reason we set up risk assessors, abatement contractors, and the like was because the code people refused to do their job when it came to lead. So that was a long time ago. It's been 30 years ago. Let's bring the code people around. And then the Section 8 program, HUD's largest program, relies on visual assessment. You can't see lead, obviously, so that needs to be reformed. Title X, arguably, was silent on the tenant-based Section 8 program. Now to go back. Single-family mortgage insurance, this was the one program at HUD that was not reformed in 1999. That needs to be fixed. These are the FHA loans. Multifamily mortgage insurance is covered. Single-family is not. That makes no sense. Fannie and Freddie are also part of that mix. The eligibility requirements are complex. Many low-income and moderate families are left out, so the income guidelines need to be streamlined and made more effective. And I think one of the things we learned from COVID is that you don't just rely on local governments. We should rely on other actors like nonprofits to be able to actually do hazard remediation and inspections and work it out at the local level. Otherwise, we're faced with a bottleneck. Training requirements are too complicated. What was the HUD secretary during Obama? What was his name? I forgot his name. Yeah, Julian Castro. But he basically said to me, look, you guys got 7 disciplines. You got risk assessors, you got sampling technicians, you got abatement, you got renovation, repair, and painting rules, you got project designers, and there's 2 others. Why do we need all those? We don't need that. So let's streamline the training requirements. Sherwin-Williams still makes lead paint in other countries, and they get away with it. They're not allowed to do that here, but they keep doing it in other countries as well. Only about 60% of the countries across the world actually have lead paint prohibitions. Homeowners are not eligible for lead abatement tax credits. If you're a landlord, you get that as a business expense, right? But you don't get it if you're a homeowner. That's not fair. As many of you know, my group, the National Center for Healthy Housing, and the American Public Health Association released a model code this could be adopted for all federally assisted housing under a new Title X. How EPA determines what its lead exposure guidelines, it's not really spelled out in Title X. In my view, they should be obviously protective, but they should also have to be measurable, sustainable, and feasible. Nobody wants a standard if it's not feasible. And then CDC needs to do better about releasing surveillance and Haines data more quickly. This is the last one. CDC hasn't updated its medical management guidelines. Excuse me.
OSHA standard has not been updated, can you believe this? Since 1978. Way out of date, right? And then the Superfund program also needs to think through how we're going to regulate lead. So appropriations have improved. This is what they look like. During the Obama years, they didn't do so well, but in recent years, they've gone up. So I think what we have is a new consensus. And I'll talk more about this evening. I will publish this, what I presented to you a little bit today, next week. And I'm also going to, it's a little teaser, I'm going to launch a new book that I've written, looking back 50 years and hopefully looking forward at what remains to be done. So stick around after the Cleveland folks in the general session.
I got an autographed copy, just so you know.
Okay.
Thank you, Dave.
And a discount for everybody here, right?
What's that?
And a discount for
Oh, well,
everybody
there
here.
is a discount. You get half off because you came to this conference and you're a member of LEHA. So stick around. Oh, thank you. Need water.
First of all, great. I think this is a great list. It is, I think it also aligns with the Pew Charitable Trust, did a strategies book a couple of years back, pre-COVID, which seems like 100 years ago, many of these. Two things I think are really important, and let's not forget that people who live in public housing should have the same standards that we aspire for private housing, and we need to lift that standard across the board for every child in America, no matter their income, right? So that is really key here. All of these are really good recommendations. But when we go to Congress to look to amend or broaden Title X, we are going to need every single person in this audience and every single person that you know and everyone, because there will be pushback and there is always risk when you open up a piece of legislation, depending on the times, it could go south. We don't want it to go south. We want it to go forward, right? So as we think about these recommendations and as you see things in the field that need to get done, hearing from Los Angeles and different places today, know that we're also going to need those voices. Coming to Congress, talking to your congressional people, regardless of party, this lowers brain damage and improves opportunity. It levels the playing field in the classroom, and it ensures that kids get to that classroom healthy, ready to learn, earn, compete for a lifetime. We have to have everybody there, not a couple of experts. The three experts up here, and I don't know how I got up here, but the realities of we need everybody from the field, from all 50 states pushing for this, and I just think that's an important point to pause on right now as we think about reforms. Absolutely on the nonprofits, because in many areas of the country, city governments, county governments aren't set up, and we have good folks across the country. We need standards, 100% really good recommendations, but don't forget it doesn't stop at the recommendations. Getting this passed is not a slam dunk.
Thank you. So we've been talking a lot about equity-driven solutions. How do we ensure that the changes to Title X would actually not go south and actually would be truly, genuinely, equitably driven? I mean, we've given some ideas, but what is the mechanism? How do we do that? Obviously, it's on message. A lot of the visitation, a lot of the outreach, a lot of the advocacy that's being discussed, ideally we're all saying the same things, asking for the same things, but what are some other mechanisms that we are making sure that we have to lead on here?
I'm going to go back to something, a transparent set of data that tracks where the dollars go, who gets hired, in the Section 3, whether we move people from low-income positions to higher income. Are we doing professional pathways in that work? You know, in Baltimore, we have a map called the Black Butterfly. You can layer in asthma, you can layer in unhealthy housing, you can layer in lead, and it's the same communities since the 1950s. We have to know that we are going to the areas of highest need, but with the dollars to build capacity in those areas. That's how you build equity, is how you recruit people to help in those communities and lift from communities. So I think tracking data of dollars, outcomes, right? So what happens when you do this? Are kids getting into school better? Are they reading better? Are we tracking those outcomes that we know are so important? I'll stop there. I'm sure I'll come back.
Well, now you know why I call these folks my teachers and inspirers. Because, yeah, I'm an addicted code enforcement officer, but I also tell people that through these folks I've been baptized in the holy waters of healthy homes, and I now preach the gospel to code enforcement officers everywhere. You'll hear me talking about the need for more code enforcement officers that are women and men of color tomorrow when I do a presentation with CC and Pete. But in terms of what we need to do to ensure that the changes are equitable, as you've heard, data. And we know where the data is coming from. It's coming from those communities of color where we need code enforcement officers to go into units and collect that data. We need to, and we're doing this in Oakland. We've actually done a race and equity impact analysis with money that we received from the lawsuit when we sued the paint companies. And won. Oh, thank you. With that money, we are going to educate, engage, and empower our community-based organizations to do some of the ground truthing that's necessary in order to get more policies and legislation adopted at the state and local level. But again, we gotta be able to get some boots on the ground in terms of code enforcement officers, and that's why we are pushing a piece of legislation that will create incentive grants for jurisdictions to help establish code enforcement units, proactive rental inspection programs preferably, but even just complaint response reactive programs so that we can do more data collecting.
And you're in Maryland, the home of the first pre-rental inspection program for lead in the country.
Yeah. So a couple things here. One is, if you're going to deal with equity, we've already seen that focusing on the affordable housing and reducing those levels makes a difference because those disparities have dramatically narrowed, especially if you look at the American Healthy Housing Survey 2 or the NHANES. Dramatic narrowing. But if you're going to get further, you're going to need to deal with the healthy homes. You're going to need to deal with moisture as the root cause, which is the hardest thing, especially in rentals, to pay attention to. So we've really got to make it a healthy homes program, as Ruth Ann said. Second, it's got to be about code enforcement. As long as we're expecting EPA to enforce the RRP from a regional office, we don't have code inspectors involved as much as we need. You're right, Larry. We're going to struggle. I think the RRP has done a lot to reduce those levels across the board, but we need to do more, and that's going to come down to code enforcement because there's the landlords and there are the landlords and the flippers who are flipping the house and selling it to somebody without disclosing, without being cared about the sanding or whatever they're going to do to that paint. We're not going to get there if we don't have real code enforcement. And that's going to take some funding. I mean, we're going to have that funding in the healthy homes and in the code enforcement. That's what I think it's going to take to get done.
And it seems to me that it's worth emphasizing the environmental justice component of this. There is a danger, however, and that is there are lots of people who love, and I like maps too, but we can so hyper-target this that we sort of miss the mountain for the molehill. This is an issue that cuts across many lines and affects many different income and racial and ethnic sectors. So we need to do two things. I like walking on two legs, right? One is we need to teach people that, you know what, we can fix this. We need hope, and there is hope. I mean, look at all that we have accomplished over these many years. But the reality is we still have a long ways to go. And so those two messages, there are people out there who say, oh, look, the lead problem, it's either it doesn't exist at all because we fixed it back in the 70s when we took lead out of paint, or they say it doesn't exist at all. Or they say it's too big to solve, there are too many houses. Both of those things create paralysis. And so what I think the best way to achieve equity is to create a sense of mission and a sense that we can in fact conquer this disease like we have so many other diseases in the past. It can be done. We have to be clear that that we need to do the right thing, especially for kids who are at high risk, but for all of our kids.
So Dave, when, I don't know, 5, maybe 10 years back, Duke University asked me to come down because they had done a study on our work in Maryland, where we had reduced lead poisoning in Baltimore and in the state of Maryland by 99%. We're at 99.4% now. And they wrote a paper that said that we had delivered back to the state of Maryland $44.5 billion in economic return. And I think the Duke Nicholson Center, the Environmental Center, thought that we were going to come down there and jump up and down. Like, look at us, look at what we've done, right? 2 things dawned on us. One, housing condition, lowering lead levels and improving housing condition are not necessarily simultaneous. So to Tom's point, to Larry's point, to Dave's point, you have to look at the whole house. And the second point was, where did that money go and to who did it go to? And how did it disappear back in treasuries and not get reinvested in communities? Whether it's a rural community in Garrett County, who probably has just as much lead to some degree than Baltimore, but it's not measured. And it was really a turning point for us about a whole house strategy. We're seeing states like New Jersey and cities like Milwaukee moving to a whole house strategy. And where does that money go and how does it get reinvested? That's why we care a lot about healthcare. All of this goes to say, we have to get to that water that's insidious, that drips in, and the extreme heat and extreme cold, and understand that climate plays an issue in this, and how we look at it. But last note, when Larry was talking about code enforcement and his religion, 2 things popped in my head. The House of Gucci movie, you know, Father, Son, House of Gucci. I kept thinking that the whole time for some reason. But in 2003, we went to St. Louis to help turn around in St. Louis, moving them from 23% of their kids being poisoned every year to less than 1, right? But where we started was with code enforcement, because people in code enforcement took a job because they're trying to make people's lives better. What we need for the code enforcers is money and enforcement that makes what they find get solved. And we've got to be focused on that. So thank you for raising that, Larry.
And thank you for bringing that up too, because, well, Tom, you brought up the thing about mold as well. And Dave, you mentioned Julian Castro. When he was HUD Secretary, we received a HUD Secretary Award for getting a mold law passed in California, and it was done through the California Healthy Housing Coalition. So we were able to bring together code enforcement and community-based organizations and try to figure out a way in which we could empower code enforcement officers to respond to mold. Because back in my day, again, when we were told, oh, you don't do peeling paint, we were also being told, oh, you don't do mold. You're not an industrial hygienist. You're not a registered environmental health specialist. You don't understand microbiology. How can you do mold? And we were able to get a simple law passed that gave code enforcement officers the discretion. If they see it, they can at least order the landlord to bring in somebody who can then test it. And so that's how we ended up getting that award from Julian Castro. But it took that effort of bringing together community and code enforcement and then empowering them. And at the same time, we ended up empowering those community organizations, because the California Healthy Housing Coalition, with that victory, has gone on to now pass a law that requires all building inspectors and code enforcement officers to respond to complaints not just about substandard conditions, but also lead, and also included in substandard conditions, mold. That was Assembly Bill 838, just went into effect July 1st of this year.
Thank you. It's very important work. I'm going to stop for a minute here and see if there's any questions from the audience, or I could keep going, but I want to make sure you all have a chance to stand up and ask any of your questions. And here's one. Yes. Yeah, tell us your name, please, and where you. Thank you. For those that didn't hear, there was some quoting of EPA data talking about 52 million or so homes with known lead, down to about 38 million. A lot of investments over the decade. So why are we still seeing the levels? I've got some thoughts on that too, but Tom.
Well, I just want to say, there's a microphone. Can we get that passed around to whoever wants
Yeah.
to talk? Because it's difficult.
Yeah.
I couldn't hear most of the comments. It's okay.
No,
don't
no,
repeat it.
we heard you.
Dave got it.
Can I say one thing about the dollars, though? HUD put out a healthy housing survey in 2021, I think, June of 2021. And there are 1.1 million families who make less than $35,000 a year living in homes with significant lead hazards, where HUD's estimate was $14,000 a home to eradicate those hazards in the home. That's a $170 billion issue. And that's what we need to, the faster we can scale and spend at a higher level to get to something that is brain damage, that is organ damage, that damages children in utero, the better. But we have spent a lot of money, but it is today, just for that sector of families, right? A $170 billion problem. What we painted on walls, that toxic legacy, is extraordinarily expensive in so many ways, but that's the number to get at that core problem, according to HUD.
Thank
So-
you.
Just to be clear, I didn't say that lead hazards have increased. I said deteriorated lead paint has increased. That's one of three things, right? Lead hazards are deteriorated paint, dust, and bare soil. So those have all come down. There has been enormous progress. Secondly, we have not spent an enormous amount of money on lead. I'm sorry. I mean, HUD's budget is probably around 45 or 50 billion a year. You know, out of that, we get not even $1 billion of that. So there is a history here, and I won't give it away, but we have been down this road before, right? In 1990, HUD estimated it'll cost $600 billion to solve this problem. And guess what happened? After they came out with that estimate, Congress said, oh, guess what? We're not going to do that. And so nothing happened. And it wasn't until the pathway science made it clear that to solve this problem, you don't necessarily need to remove all lead paint from all housing. Now, it's still expensive. Ruth Ann is right. It's not going to go away by itself, but it's not a huge thing that the economy can't shoulder. We can do this. You either pay me now or you pay me later, right? I mean, we're going to, and so we should be smart about it, make the investment now, and not continue to do surveillance. And lastly, Larry, I did want to mention to you, my dad was a minister. So I baptized him. I'll baptize all of you if you like. I'm not a minister, but it's in the blood.
Well,
I'll baptize him anyway.
well, here's a bit of prophecy for all of you. HUD could start giving you more lead hazard control grant monies, but I guarantee you're going to have a hard time getting property owners to use it unless you have code enforcement going out there and writing some notices and orders, some notices of violations. Because I know back home in Oakland, California, we've been struggling for a while now to get property owners to come forward. Even with the lead paint settlement money, which doesn't have the federal strings attached, we already know that landlords are not that interested in just coming to us and saying, here, give us this money, we want it. No, they come to us when code enforcement says you've got a violation and you need to correct it. I don't care how you do that. And if you've got some money that you can go and get to do it, that's fine. Otherwise, you may have to dig into your own pocket, but it has to get done.
Data shows a 10-to-1 return on enforcement. 10-to-1. Grant program, enforcement. In the 99% reduction that Maryland experienced in a 12-year period, it was when we added stronger enforcement. Within 3 years, 46% of that number occurred by putting strict liability in place for adherence. And so today in Maryland, if you are not in compliance with the Maryland Lead Risk Reduction in Housing Law, it's an illegal rental. You cannot collect rent. You need to have that kind of teeth in a law to make a difference. And, you know, we talk so much about rental properties, right? But on the rental property side, people are in the rental property business typically to collect cash, collect money, right? You stop the cash flow, people will pay attention. Really super important. But I do think we have a big, big issue also with homeowners at time of sale, that we need to come up with a mechanism that puts some stricture on if you're selling a lead house other than an incentive to not know that you have a problem. So we've got to really concentrate on the disclosure issue that Tom brought up, I think.
Thank you. Any other question? Yes.
Hi, I'm Rebecca Munich with the Ecology Center and the Great Lakes Lead Elimination Network. And we've built up a coalition of partners in every Great Lakes state working on public policy at the local and the state level. And we're coordinating our efforts and resources to be able to do that. And we're hungry for action at the federal level and how we can engage. We have good relationships with our congressional delegation members, but we're not in the Beltway groups. And so my question to you all is, this is fantastic, and then what are the next steps, and what is the leadership to bring coalitions like our own involved and get us engaged, and folks are fired up to do this. So that's the thing. I'm excited and want to figure out what's next.
Well, there needs to be a broader coalition that lifts the leadership of you all. So if we just look at the success that just happened in climate opened up and really put in a much more equitable way of looking at the ground level community organizations up. So some of the absolute, as I said before, some of the absolute best things are happening in front of us at the local level, and we have to raise those up. So we need to strengthen that network together. And senators, congresspeople really do listen to the people in their own state. But we have to have this happening across the country in that way. Talk to you offline. There is the National Safe and Healthy Housing Coalition. We need to support that work. There's a number of different coalitions. We have to bring more than one voice and more than one coalition. I think that's a bit, NSA will know this better than I. We sit on a couple of things together about climate, but having multiple forces speak up, not one or two organizations or one or two people being seen all the time, but what is happening out of Great Lakes, what's happening in Cleveland, what's happening in Milwaukee, what's happening in Alameda, all of that has to come up together and be heard as a wave. And that is the change that made it possible for $369 or $89 billion to go into the Inflation Reduction Act versus we are sitting here at $500 million a year and celebrating that that's higher than 110. But good on you, and you guys are doing amazing work, by the way.
Well, we look forward to connecting more.
So very quickly, the key thing is we're not alone. And so in previous conferences, this conference, in fact, we have gone to the Hill. We had Hill Days. And we usually took a physician and a mom or a dad and a local mayor and others, and that really worked. So join the National Safe and Healthy Housing Coalition. Join LEHA. I mean, the reality is that every other assisted housing program at HUB, they have their own assisted housing associations. We need one too, and they will pay attention, but only if we're organized. And so that is what the coalition is about. Where's Sarah Goodwin? She's the honcho with that. So if you're not in that, and if you're a local government, you can join that coalition. We're not lobbying, we're educating. And so there is a vehicle for you to do that. So join the coalition, join LEHA and make your voices together more powerful than they are on their own. But there's lots of coalitions out there, and we need to basically make sure that that we give them voice. Sorry, Tom.
I mean, the politics is you got to have all the stakeholders sort of at the table. So you're going to have to get landlords, the renovators there. It's tough. It's really tough. But you got to figure out why they're not interested and figure out how to get them interested, which may mean stronger code enforcement so they have reasons to be at the table. It may mean enforcing the RRP rule so that they have a reason to be at the table. It may mean EPA getting out those lead hazard standards so they've got a reason to be at the table. If we don't do that, if it's just, it's got to be bipartisan, and bipartisan means you're going to have some of those other stakeholders at the table. It's just the reality.
Please be thinking about like your last 30 seconds. Oh, please, you should speak. And then your last 30 seconds as we wrap up, and I'm going to give a couple resources as well.
Yeah, I was just going to say in Sacramento, we did have a rental housing improvement partnership that included tenant, landlord groups, and code enforcement. It wasn't easy, and I guess I should add to that in terms of you partnering with code enforcement within your local jurisdictions. You will experience, in many cases, pushback. It won't be easy. Tomorrow, when CeCe Moella, founder of Women Leaders in Code Enforcement, will be here with me talking about strategies to build partnerships with building inspectors and code enforcement officers. We can go into that. How do you build those partnerships, which I think are really necessary. So.
We've got a lot of things going for us, and I mean that's been talked about as well. It's especially as a public health oriented person, it's very easy to get caught up, especially in this region, with all the things we haven't done. And yes, we have a lot of things to do. Like I just said, our organization just turned 30 years. We shouldn't even have to have an organization nationally focused in the United States of America in the year 2022 that has to remind people constantly, what about kids? How is that policy going to impact kids? How is that going to impact, the health of kids 10, 20 years now? But it is a reality that we're in. So what we have going for us, we all have the emotional connection to these issues, right? When you see people that become harmed, unbeknownst to them, just because of the zip code they're living in, or the families they're born into, or the streets they're living in, or the schools they're going to, there's an emotional connection there, right? When a young child hasn't even had the chance to start to grow and develop because they've had so many ways that they've been beat down before they're even 5 or 6 years old. So that emotional connection, in my experience, is what I have seen as far as people actually listening, focusing in on the various coalitions that do rise up together with the strength of one message and call for some specific targeted action. The Children's Environmental Health Network has Children's Environmental Health Day. It was last Thursday. It's every second Thursday of October. It's a day for and with our youth, our children, who, by the way, I think are an amazing group of folks who we can learn a lot from, who are just done with the stuff, right, of making excuses and the many reasons why we can't do things, but at the same time, they kind of need to grow up before they can be the type of leaders that they want to be for this country. So I would call on all of us to do the type of things that we need to do, be responsible stewards for them. So that day is one of many, right, that we can all use as a platform. There are proclamations that are acquired during Children's Environmental Health Day, city level, state level, that you all can lean on. And if you have an interest in knowing whether you have a proclamation in your area, let us know. It's not a photo op. It's a way to genuinely engage with your elected officials. It's kind of hard, it's very hard and Hippocratic, right, to have a proclamation that you're protecting children and at the same time have atrocious or lack thereof policies and standards that are totally doing the opposite. These become engagement tools to do better, right? It's not about finger pointing at this point. It's about let's just get to the business of getting work done and accomplished. Treatment costs a lot more than prevention. There's an economic side of this too. So if any of you want to connect with health economists to add to your mission and your advocacy and the coalition work that you're doing, that tends to be an addition that is very hard to penetrate on the other side, right? When it's economically feasible, when it's healthy and viable, and it's going to benefit the overall community, it's very hard to make a counter argument on that. So with that said, I'd love for our panelists to just spend like up to 30 seconds on your final thoughts, any key recommendations you really want to tease out as far as, I love the question about next steps and opportunities for this incredible group of advocates, leaders that we have in this audience.
I'm going to push an envelope here. And that is Bruce Lanphier and others have shown that it's not just kids. It's adults. It's heart disease. It's death. And death is pretty serious to most people. And it resonates for those who may be a little older and a little less caring about kids, who talk about kids, but really care about the heart. So we can translate it and expand the discussion so we can bring in heart disease, bring in adults. It's hard argument, but it matters because the dollars go way up and you start to get to the size that you were talking about, Ruth Ann.
Thank you, Tom.
So we just got through, I mean, we're still in COVID, right? The problem is that the communicable and non-communicable disease construct that public health relies on doesn't work, especially when it comes to housing. COVID showed that. Houses have to be healthy if we're to protect ourselves from communicable disease. Housing is part of the infrastructure. There was a bill in Congress called Housing is Infrastructure. In the environmental world, the shared commons is what undergirds most environmental statutes. But that's not thought to be part of the infrastructure, but they are. Houses are private places, but they're also part of the infrastructure. And finally, in the housing world, and I am a housing provider in DC, we control whatever it is, 150 units that we rent out through a nonprofit. The housing has been perceived as a wealth builder. That's not entirely true either. So those three domains are linked, right? We have to break down the silos between communicable, non-communicable disease, environmental law, and housing as a wealth builder. If we don't get that straight, we'll end up where we were in 2008. You all remember that? That was a housing crisis. It was a finance issue with mortgage. So we don't want to go there again. We need to fix it. And we have solutions that span all three of those domains, in my view. Okay.
Thank you, Dave.
So as we think about this, for some reason, as you were talking about housing as wealth, but I just want, when we think about health disparities and racial disparities in this country, those inequities have cost us over $16 trillion out of our GNP. By creating a baseline by which we ensure every child is healthy from the start and has the ability to get into the education system with a better opportunity to succeed, our general good across the entire country is better. So we have to think about that, and we have to move from well-intentioned to intentional action to be able to scale. One of the most frustrating things about all of the programs that have gone through Congress, whether it's the first version of Build Back Better, the bipartisan infrastructure bill, the Inflation Reduction Act, is the only thing that was really left out of that equation was lead-based paint. Lead-based paint is still the primary reason that children in this country get lead poisoned. Water, definitely important. Touches all of us, cannot say enough about its importance. But it's the one thing that was overlooked. So I have to go back to the Great Lakes question, or here, which is all voices needs a rise. We can't just rely on the same well-intentioned, pieces that we've had. We need new voices. We need strong voices. We need data. We need data with a soul, which is data and stories about families. We need the cost analysis. It matters, right? The cost analysis matters because people lose wealth. They don't get out of school. They're going to earn less. And we need the data, the kind that Tom was talking about. If you're exposed to lead, you'll have a 16 to 19% greater chance of cardiac arrest, right? Ellen Silberfeld told us that. She won a MacArthur Award for it. But you'll also have a 46% early mortality rate, robbing families of the joy of their own loved ones. All of these things matter, but lead-based paint got left out of a lot of what just happened. We have to smartly align. I'll talk about that in the next session. Smartly align with other things, but we ought to have a bit of a chip on our shoulder and go fight with a chip on our shoulder to change that because this is the smartest investment you can make, because we know what the benefits are. If we fix it, we can control the cost of that, and we open up so much more opportunity for all of us.
Thank you, Ruth Ann.
I think that was the drop the mic moment. There wasn't anything else I could add to that other than, again, I'm just so happy to be here with you all, to be here with some of my rock stars, my mentors. Dave, you talked about, the COVID thing. I mean, I take care of two immune compromised members of my family, so I tend to wear the mask more than others, but the fact that we're all here now, in spite of we're still coming out of a pandemic, just shows me that you all care. You all take pride in what you're doing, because I think you all care about the goals that you have in terms of what you're doing. So, Ruth, you said it. Ruth Ann said it. Let's all work together. Let's keep this going. That's the only way we're going to be successful.
Thank you so much, Larry. And I would just also add, where we heard we can fix this, and I would also add this is so urgent that we must fix it. Again, the days of allowing certain communities to avoid certain health exposures and others not is just not okay. Again, we all want to thank all of you, every single one of you. Every single day that you spend on this work is vital, and your communities thank you for it. People you'll never meet, you're benefiting their current and future health and well-being. Thank you to all of our panelists. Thank you for the opportunity. Have a little break, I think. Thank you.
Thank you. Thank you so much.